So the first thing that I'm going to cover, and that I think it can be very confusing, is the difference between normal aging and dementia. I just hear from a lot of family members, and they say, "Oh, my mom's memory is starting to go. She must have that A thing, that Alzheimer's thing." And I want to really squash that. I want to make sure that people understand that that people are not guaranteed to get Alzheimer's disease or any form of dementia at some magical age that we reach at some point, like 76. I'll just throw a number out there. Some people say, "Oh, if I live long enough, I'm going to get dementia." Not true. So as we age, our bodies, our endurance goes down a little bit, our strength goes down a little bit, but when we're talking about our memory and our cognitive impairment, there are really only very subtle changes that occur as we age when it comes to our memory and our cognitive functioning. So things like, and I do these things, so it could be at any age really. So when we're talking about subtle changes or typical changes as we age, we're talking about you miss a bill, you forget to pay a bill on time, you mess up your checkbook, you carry a 1 incorrectly and the balance is incorrect. You forget where something is, but remember, sort of backtrack and figure out where it is a couple minutes later, okay? You make a mistake every once in a while. We all do those things, okay? What we get concerned about at the Alzheimer's Association is when we're talking about cognitive changes that start to affect your day-to-day functioning. So when you can't remember hardly any of your bills, and you're getting your family's fine shut-off notices on your kitchen countertop. Like, "Mom, what's this? This is the electric company. They're saying they gave you 3 notices. What's going on here?" Or all of a sudden, you know that Mom was a good saver, and all of a sudden the bank is calling and saying, "Mom's been making all these withdrawals. What's going on?" The neighbor's calling and saying, "Mom's walking around in this freezing cold weather with no slippers on and a sheer nightgown. What's going on?" So we're talking about more significant changes when we're talking about dementia, which is more than normal aging. We're talking about cognitive changes that are starting to affect your day-to-day functioning. Again, if you misplace something and figure out where it is a few minutes later, that's not going to ruin your day. Might ruin the moment, but it's not going to, really going to affect your day-to-day functioning. Okay. So a really good example that I like to use is the difference between misplacing your keys, which who doesn't do that, right? When we have such a rushed, busy life, and we come in and we put the keys down somewhere and we go and do 8 other things, and then, oh, where'd the keys go? So there's a difference between misplacing your keys and coming across those keys and not realizing that those are called keys. You don't remember what keys are used for. You end up finding the keys in the freezer or some really odd place where keys really would likely, not very likely be. So you can see the difference between just sort of an average run-of-the-mill misplacing keys and really a step very much beyond that. So when we're talking about dementia, I'm going to go over the difference between dementia and Alzheimer's disease, because I know that those two terms get used really interchangeably when there's actually a distinct difference between the two of those. Has anybody ever wondered or heard that those two terms used very interchangeably? Okay, so dementia again is a decrease in your cognitive functioning to the point where it affects your day-to-day functioning. So when we're talking about cognitive functioning, what exactly does that mean? Even that term is a little vague. So cognitive functioning includes things like your memory, your judgment, your insight, your awareness, your reasoning, your just ability to sequence and think through things. So there's a lot that goes in it, but it also can have things to do with your mood and your personality as well. There's a lot of changes that can happen when we're talking about cognitive functioning. So that's dementia. Dementia is a broad overall term that describes those changes in cognitive functioning that impact your day-to-day functioning. I'm going to break it down even further. I like to use the example of a fever. So a fever tells you that there's something wrong, but it's not a complete diagnosis. Think of dementia in the same way. Dementia is, whoa, there's some things happening here. I want you to pay attention to this, okay? I'm having some short-term memory problems, getting a little confused with time or place. Pay attention to me, okay? But it doesn't tell you the whole story. just says pay attention. So same thing with a fever. Fever tells you something's wrong, it's not the complete diagnosis. So when you start noticing those cognitive changes, that's when you need to go to the doctor and see what it is. Because it could be Alzheimer's disease, but it could be a condition that is otherwise affecting a person's cognition that has actually nothing to do with Alzheimer's disease. So I'm going to break it down once, and then I'm going to get back to what Alzheimer's disease is specifically. So again, dementia is that broad overall term. Alzheimer's disease is the most common type of dementia, okay? So under sort of that umbrella of dementia is Alzheimer's disease, which accounts for what we estimate is over 60% of all dementias are Alzheimer's disease specifically, but there's also vascular dementia. Has anybody ever heard of vascular dementia? When maybe your loved one or the person that you're caring for has had a stroke, series of mini strokes, has had really a long history of untreated high blood pressure even, lots of vascular issues. So that can cause some dementia later on in life as well. There's also Lewy body dementia, frontotemporal dementia. Frontotemporal dementia, just like it sounds, it affects the front part of your brain and the temporal part of your brain. We hear a lot about that. We've heard a lot about that over the past couple of years with professional athletes, hockey players, football players. So there's a lot of Huntington's disease, all kinds of different dementias, and Alzheimer's disease happens to be the most common form of dementia. So if someone says, my loved one has dementia, you might say, oh, geez, that's awful. What type of dementia do they have? Because the doctors are going to want to know or are going to want to try to find out which specific type of dementia it is, because you're going to treat someone who's had a stroke differently than someone who has frontotemporal dementia, Alzheimer's disease, etc. So reversible conditions, because I'm sure you're wondering what those might be. So if you or your loved one are experiencing some cognitive changes, then some reversible conditions that could be the cause of it are things like an infection, urinary tract infections, pneumonia. Those are two big ones where we see some significant changes in a person's cognitive functioning and their overall functioning. Malnutrition, so vitamin or mineral deficiencies, dehydration, side effects from medication, or if a person is having some memory impairment, they may not be taking their medications correctly, taking too much, too little, that may be affecting them. Depression, thyroid issues. So as we can see, there's a lot of things that can cause changes in your cognitive, and there's a lot more. So there's a lot of things that can cause changes in your cognitive functioning that have nothing to do with Alzheimer's disease. And all the things that I mentioned, if you go to the doctor and they diagnose it properly, you can treat those things. So you don't have to feel like, oh, I'm having, my husband's having some memory changes, I shouldn't go because there's a possibility that could be Alzheimer's disease. The fact of the matter is it could be so many other things before Alzheimer's disease, really. So those are the reversible, the things we can do, conditions, the things we can do something about. So Alzheimer's disease is at the top of the list when we're talking about irreversible types of dementia. So again, those are Alzheimer's disease, vascular dementia. Again, if someone has a stroke or a mini stroke, we can't reverse that. We also can't reverse many times the damage that's caused by those conditions, which is why we want to make sure our blood pressure is within normal limits, and other things like that. So other irreversible conditions, again, frontotemporal dementia, Lewy body dementia, there's quite a number of them. But again, we can't, once a person starts developing those, we can't reverse them. We can try, when it comes to Alzheimer's disease specifically, we can try to slow down the progression of the disease. And that's really, I think, what Jen's going to talk about, connecting people with community resources, like as soon as a person gets diagnosed, even just encouraging them in the first place to get diagnosed is a great place to start, because the sooner you get diagnosed, the more options you have for treatment, the more planning and involvement you have in your future care, just the more choices in general that you have. So let's talk about Alzheimer's disease. I want to make sure I spend a few minutes on that. So what do people know about Alzheimer's disease? What is just the first thing that comes to your mind when you think of Alzheimer's disease? You think of being really hungry? Scary. That it's a really scary disease? What does it affect in the brain?
Memory loss.
Memory. Big one, right? The first thing we think of. So the reason for that, the reason why Alzheimer's disease is so associated with short-term memory impairment is because Alzheimer's disease, the damage that's caused in the brain by Alzheimer's disease starts in a little part of the brain deep inside the center of the brain called the hippocampus. And the hippocampus is where we store short-term memories and where we learn new things. So if that's the first place that's damaged by Alzheimer's disease, those are the first symptoms we're going to see, okay? And I'll give you an example when it comes to, we all know what short-term memory is. It's not maybe remembering what you had for lunch or breakfast, but a lot of times people with Alzheimer's disease, their long-term memory is very much intact. They can remember the song at their wedding, the hospital where they had their first child, their dog, their street name from when they were in 6th grade, all these different things. But again, whether or not they took a shower that morning, what they had for breakfast, it's gone. And just like right now, I always joke, I was telling Jen this earlier, if I sometimes get a little off track, it's because, I work at the right place. I work at the Alzheimer's Association. So when we're talking about Alzheimer's disease, and again, I just lost my train of thoughts, which is perfect. So the part of the brain that's affected by Alzheimer's disease first, again, is the hippocampus. When we're talking about learning new things, I'll give you the example of a cell phone. I know a lot of people that say, oh, it's fine, my loved one has a cell phone. Cell phones don't even look like phones nowadays. So if you're trying to teach an 83-year-old Italian woman who has never had much technology in her life to use the microwave or to use that cell phone in case of an emergency or for other purposes, it's probably going to be very difficult if she started having those memory changes because she's not going to retain that information, and those pieces of technology end up being virtually useless or even dangerous when we're talking about like a microwave. I know a lot of people that burn things in microwaves just because they've just never used one. They're used to cooking from scratch and using an oven, but it's not safe for them to do that anymore either. So what happens in the brain in terms of the damage that happens in the brain that starts in the hippocampus is damage that we call plaques and tangles. We've all heard those terms kind of floating around in the universe. So plaques and tangles, plaques are a buildup of this toxic gunk, I like to call it. It's called beta amyloid. Our bodies naturally make amyloid, but when it comes to Alzheimer's disease, that amyloid gets kind of snipped in a certain way and it becomes really sticky and it sticks to all of those other little snipped pieces, and it sticks together and it builds up in between brain cells and inside brain cells. And what happens when brain cells or neurons in our brain, when they can't communicate with each other, you're not going to function properly and the brain cells will eventually die. So over time, more and more brain cells die, and that's why with Alzheimer's disease, it's a progressive degenerative brain disorder, which means that it's progressive, it's going to continue to get worse. It's degenerative because brain cells are dying over time, and obviously it affects our brain, okay? So what we want to do is slow down the progression of the disease as much as possible. So instead of having the progression of someone's disease be like this type of ramp, we want to really get people diagnosed early on in the disease process so we can sort of level it out, plateau it out, if you will, give people the best quality of life for as long as possible, okay? So the other thing that I want to mention is that with Alzheimer's disease, there's no roadmap. I have a lot of caregivers and people in the community that just say, well, once someone experiences short-term memory impairment, like what happens next? And I'll say, unfortunately, I don't know. What we say is that if you've met one person with Alzheimer's disease, you've met one person with Alzheimer's disease. So my grandmother, she could be very withdrawn, not really verbally, not verbally communicating with us a lot, paranoid. She could be experiencing those types of things, whereas someone else's loved one could be very vocal, resistant to care. They could be falling. They could be exit seeking and wandering. They could have totally different sort of experiences and disease processes. And that makes it very difficult for caregivers, because I can't tell any of you in this room, if you are a caregiver, that it's going to play out like this, like in 6 months, it's going to look like this. So Jen's going to talk about community resources, and the Alzheimer's Association, is one of those resources. And really the goal of community resources, including us, is to make sure that your family and your loved one who's experiencing the memory impairment, that those needs are being met, whatever your specific circumstances are, because this disease is so unique to each person, to each family, to each community, that we really want to try to meet the needs of what is going on with that specific family or person. And the only other thing that I'll leave you with, because I know we have limited time, and I know we'll have plenty of time for questions after too, is that I really want to harp on the fact that getting an early diagnosis is the most important thing. Like I said, you may go to the doctor and find out your loved one has a urinary tract infection. They get a stint of antibiotics, and in 10 days they're feeling 95% better. So I really want to encourage people to not be afraid to go yourselves to the doctors, or to encourage your loved one or someone in your life who's experiencing some changes to go to the doctors, because it may very well not be Alzheimer's disease. And if it is, then you can contact us, or this will segue nicely into what Jen's going to talk about, and you can reach out to any of the various community resources that are available in our area.